Officials are watching those numbers closely, and that has prompted discussions in Ontario at the highest levels. Marina von Stackelberg joins us with more. And Marina, as we talk about anxiety around the return to school, for example, what do we know?
The Ontario Cabinet met today, CBC News has learned, to discuss bringing in potentially stricter measures. They're looking at gyms, they're looking at restaurants, in-person dining, and they're also looking at retail. Now, sources tell CBC News that the Ontario Cabinet also discussed when students should return to class, but could not say whether a decision on that has been made. Now, this all comes as doctors in Ontario and Quebec say those huge case counts that we've been seeing are now turning into hospital patients. The Omicron wave is arriving at hospitals.
I'm working in the hospital. I'm going in every day. I can see that it's a problem, to be quite honest. I see that our beds are filling up. We lack the capacity to care for the patients.
Part of the problem, Omicron is incredibly infectious. Many patients admitted to hospital for other reasons are testing positive for COVID too, which changes how much care they need.
When a patient's admitted to a COVID ward, often you have more staff looking after them. There's more positive protective equipment. You need to clean the room differently. So even if someone isn't very sick with their COVID, if they're admitted for another reason and they're COVID positive, it's still a much bigger burden of care on the healthcare system than if they didn't have COVID at all.
Omicron appears to be less severe than Delta. Vaccines offer a shield against the worst symptoms.
The cases that we've seen in the ICU of late, and certainly it seems like the patients have turned around a little bit quicker, which we think is obviously a positive sign.
But the sheer quantity of infections guarantees hospitals will feel an impact.
That small percentage of a massive number of people getting infected still ends up being a lot of people that require health care. And we also have to remember our healthcare system was stretched even before this wave.
As hospitals have started to fill up in Ontario and Quebec, ICUs in other parts of the country are still quiet. But like other waves before, central Canada can be a sign of what's coming.
For those jurisdictions like Saskatchewan, for example, who are saying, it looks like everything's okay, we're just going to watch. Well, by the time you see those hospital numbers and ICU numbers climb, it's already too late.
In Ontario, some doctors say it's not too late to blunt the wave.
There's very little we can do to slow down the spread, but there are some things we can do. And if we do slow down the spread even a little bit, it will give the healthcare system a chance.
So some doctors are hoping restrictions are coming. When will we know more about what Ontario's cabinet discussed tonight?
CBC News has learned that an announcement from the Ontario government could be coming as early as tomorrow. And now doctors that I spoke to today said these government policy decisions are having a real-time impact in our hospitals. Ian?
Thanks, Marina.